Welcome back to Products and Health Tech, a community for health tech product leaders by product leaders. I'm Chris Hoyd, principal at Vinyl. Today we talk with Dr. Caroline Yang, the Associate Medical Director at Mass General Brigham and a practicing physician in the Hospital at Home program. Dr. Yang shares valuable insights on the evolution of home-based acute care, the critical role of technology in enabling hospital-level care outside of traditional settings, and we also touch on the exciting potential for AI and data analytics to transform patient care and the scalability of programs like that. Let's jump into that conversation. Dr. Yang, thanks so much for joining us today. Let's jump right in. So can you tell us a little bit about your journey into the healthcare at home space and what sparked your interest in bringing acute hospital care into the home setting?
Yeah, so I have always had an interest in the intersection of innovation, business, and medicine, and really decided to pursue clinical medicine and do the full training and become a physician because I felt like to really understand the problems of the healthcare system, you really need to live it day to day. And so that was really my motivation and inspiration to pursue clinical medicine, but always have an eye towards how can I innovate? How can I solve problems creatively? And how can I leverage, nowadays, a lot of the technology solutions we have are great options to be able to address some of these problems that historically we haven't had the technology advanced enough to solve.
Can you maybe talk about, some of those most recent sort of technological paradigm shifts and what you're seeing in your work today as far as what they're enabling?
Yeah, so I think separate from medicine, technology has advanced tremendously over the years. And I think right now it's that perfect inflection point of an openness to embracing technology within healthcare. I think with the pandemic, some of the silver lining was that we were forced into a situation that we needed to find a creative solution quickly. And we had the technology. And so it was really the change management piece that was really challenging to move people to a mindset that was more open and, willing to try integrating technology more into clinical care. And so I do think that shift has really allowed for many other doors to open where creative technological solutions can provide assistance or further solutions to a lot of our healthcare problems.
Very cool. Are you able to speak about any specific projects or recent maybe launches or releases that you've been a part of?
Yeah. So in the home hospital space, we rely on technology greatly. And technology is really the backbone of allowing us to provide the care outside of the four walls of the hospital because we need an ability to monitor these patients remotely and at all times and reliably. And so the technology piece is super important. And to be more specific, a lot of the remote patient monitoring that we do, we recently made a transition from one vendor to another in February. And that shift really introduced the opportunity to both standardize across our program. So our singular home hospital program across 5 sites has really allowed us to scale our program and to care for more patients because we have the technology and the capability to do so safely. And it's always a work in progress. I think other digital solutions, obviously we work heavily out of the EMR. And so at MGB, we use Epic, but we really have had to cater and build special solutions for the home hospital space because it is so new and adapt some of what exists within both the inpatient space and across the ambulatory space. Different functionalities that have, together allowed us to deliver home hospital care through Epic in really meaningful ways. So I think those are probably 2 big examples of technology and how important it is for those technological solutions to be of a reliability and an accuracy that will allow us to care for so many patients at home at one time.
Interesting. So I'm curious about that sort of constellation of stakeholders and products and how they have to be connected, integrated, interoperable, and where you and your team sort of fits into that. So obviously, Epic is the 800-pound gorilla in the health system space. It sounds like you just started working with a new vendor focused on remote patient monitoring. I'm curious, just, and not to get too in the weeds, but what does your team look like, sort of sitting in between them, discovering, new integrations or new features or even new products to sort of innovate or build? How does that sort of factor into your day-to-day, and how's your team do that?
It's definitely an ecosystem, and there's definitely many players. I think the key is really the communication piece. So for example, when we were moving from our last vendor to our current vendor, a lot of the build part and before go live was focused on how do we get the information that is most important for our clinicians to provide the best clinical care they can, and how can we leverage their technology in ways that are meaningful to the way that we deliver care, our existing workflows, and what adaptations do we need to make based on the technology that they have. So it's completely bidirectional and dynamic, and we are still every day iterating, improving, giving feedback from both ends. And that is absolutely imperative to having this be successful and to have that collaboration between industry and also the healthcare provider, and in a way that really supports the provider and the clinician rather than hinders them. Because we all know, the history of EMRs from the very beginning. I think oftentimes the clinical input has been less front of mind. And a consequence of that is that because these people are the end users, there ends up being a lot of friction and barriers in utilizing the technology. So I think that those lessons learned definitely informed our approach to taking on this new vendor and building escalation protocols that are relevant to us and fit our workflows, and also creates the least cumbersome on-ramp or learning curve for our existing team members to adopt this new technology. So the change management piece is huge and probably one of the biggest barriers. So I do think that communication and the dynamic nature of the relationship really informs a lot of the enhancements and progress we make together to be able to provide the best care that we can to our patients.
So now I'm kind of curious about on the patient side or the outcome side. How are you measuring success? Like, what are some maybe success stories you've seen recently? How's that going, and where do you sort of see things advancing in the near future?
So anecdotally, absolutely have heard many, many stories of patients that I myself have directly cared for, that you have family members and you have patients really expressing gratitude for allowing them the means to stay at home and be cared for at home. Because this is, we talk full circle of back in the day when we did home visits with your primary care doctor, but this is actually, a step higher or a new world in that we're providing acute level care, inpatient level care to patients in their home, and leveraging the supports that they do have in their existing home environment to make it the best experience it can be and the safest experience it can be. And so we oftentimes will have people who end up back in the emergency room for maybe something else in the future, and they're always asking, can we come back, even before we've really screened them, to say, yep, you're appropriate. So that's definitely a testament to people who have had a good experience and had that satisfaction. And even more so now that we're at a scale that we're hearing, oh, my mother did that program, or my friend did that program, or, my cousin did that program. So there's just the word of mouth has been tremendous to share with us that it has provided a lot of benefits and patient satisfaction to our patients. So that's definitely a testament. And I think in terms of like how we measure success, I think that's a huge part of it is the patient experience. Like, you cannot neglect how important that part is in continuing to scale, continuing to grow, and finding the motivation internally with your team to say, this is meaningful work, and we're finding meaning as providers in doing this type of work in the home. And of course, we have standard metrics like, readmission, 30-day readmission, and length of stay as a barometer to see how we're doing relative to prior. But I do think there's just not enough that can be said about the true on the grounds patient and provider experience of this hospital at home program.
Yeah, that's incredible. Okay, so I'm curious now if you can speak a little bit, at least, to the details of the kind of the tech that is used in the patient's home. And I'm sure there's some variance, but when you think of maybe a typical patient setup, what kinds of like what's the interface? What kinds of equipment might be in the home?
It's interesting. This has evolved a lot. So I started in 2020 with the Home Hospital Program as a provider. And back then, we had, 3 to 5 patients on service a day, and it was really just one MD on a day, and it was 1 to 2 nurses on a day for the entirety of the week. And now we've scaled to, we have a bed capacity of 50 right now with an average daily census approaching 40. And we have many paramedics and nurses and APPs and MDs who are all part of the team, including many other non-clinical members that support our everyday. And talking about the technology, when I started, was really patchwork. We didn't have a RPM platform per se. We had individual device solutions that provided data. They maybe had their own app or web platform for providers to adjust thresholds and look at data. But it was really kind of put together in a piecemeal way. And then, I supported the onboarding of all of our team into Bioformis, which was the vendor that we used prior. And this was in 2021 or so. And that shift really put us onto a platform that was more cohesive. We weren't in so many different interfaces, and it allowed us at least a step closer towards sort of the integration and sort of having a one-stop shop. And their device, the devices were most of the ones that we use regularly were connected. We had a vital patch that did sort of the continuous ECG monitoring and some of the other continuous biomarkers. And then we had the blood pressure cuffs that were Bluetooth enabled and scales that were Bluetooth enabled. And I think with time, the user experience changed and that we were actually engaging more of that connectivity and that we were actually connecting our scales via Bluetooth and all that. And now I think we've evolved to a place where in the most recent transition from Bioformis to Current Health, which is our current vendor, I think with every change, you lose some things, you gain some things, you learn some things. And so our current setup is we have a single lead continuous ECG monitor, and a false detection solution that is kind of run separately or is non-integrated. And then we have our RPM platform through Current Health that does a lot of the other continuous monitoring through their own proprietary armband that does some continuous monitoring with temperature, pulse, oxygenation. And then we also have Bluetooth enabled oximeters and scales and blood pressure cuffs that kind of come with that. So largely the same build, but obviously just a little bit of difference in terms of like who owns what piece. And the goal is with Current Health and these other vendors, the Falls and the ECG, that they'll all be in the short road ahead, integrated into the one platform. So I think we're constantly improving, constantly getting feedback. And I think, again, it's really important to take the feedback of the patient experience and the provider experience to inform where we go next, what capabilities we need, and what we ask for.
It sounds like a fair amount of that data you might be getting, what you're tracking, enables you, to react quickly to something, whatever, harmful happening to a patient. Is there, when you think of like the holy grail as far as like functionality for this kind of thing, does it get into, anticipatory interventions or preventive? Like, what do you sort of imagine out in the future that we would love to see?
I'm a big proponent of how much we can integrate AI into clinical medicine. And I do know it'll take time. Just again, physicians and other providers and other clinicians, that we're so used to doing some things one way, and it provides this sense of security and safety, because that's paramount when you're taking care of patients. But I do think that AI solutions can really work to augment the function of our on the grounds providers and our, warm human beings that are, here to provide the care, because our bandwidth is only so much. And so having the support of technology to be able to do predictive analytics or to do anticipatory guidance or to help triage patients based on sort of preset algorithms, I think is going to be super important to be able to allow us to scale the way we want to and to avoid clinician burnout. Because we can only do so much. And so if we are feeling really supported in a lot of the more manual tasks or a lot of the other tasks that can be automated, that leaves us way more bandwidth to actually be with the patient, to be bedside, to think more about the complex cases that we have. And so that's really where I see us moving towards, and we need to leverage a lot of the smart technology we have to be able to get there and to scale to the degree that we want to. Because imagine like if we're monitoring, 200 patients at one time, it's really nearly impossible to catch everything and even if you're seated in front of a computer for the entire day nonstop, human error allows you to miss things. And it compounds because people are exhausted, like they'll miss things. And so having that technology, like I said, to support and augment the function of the people that we do have, is going to be super important and in many, many ways. So I do think that also just personalization of care using technology to say like, based on this patient's story compared to other patients of their demographic or of their comorbidities or their experience in home hospital, we can predict that their length of stay will be this, or we can predict that they might have this complication, or we might predict that they will probably be escalated back to the hospital based on everybody else that's preceded them. I don't know that it's a good idea to take them. Or if you take them, let's mobilize resources early so that we can try to prevent and minimize the chance of them decompensating. So I think there's a lot of opportunity that we haven't even tapped into yet and will continue to grow and be more reliable as the technology advances. So I think this is really the time. And this is really the time for industry and healthcare providers to come together at the same table and say, hey, we're trying to address the same problem, and there will need to be openness on both ends. But I think in medicine, the key really is like, how does it impact the patient experience and patient outcomes? How does it impact providers' experience? And then how does it eventually, for better or for worse, support the bottom line of hospitals to stay afloat and to find that return on investment that they need to see to be able to continue to scale, to put investment into these programs to allow them to grow. And I think we're just right at that point of, shifting into something that could really explode. And so I think we're well on our way. But I do think that sort of next key is the technology, because that will allow us to move to a whole different level that we historically haven't been able to.
That's incredibly exciting to hear about. And the really beautiful vision. It sounds like it's not science fiction anymore. I'm curious, sort of from the product management or product leadership angle, that is an ambitious vision, right? And there are stakeholders, each with their own, roadmap and agenda. And as you said, business model. If you could speak a little bit tactically, how do you and your team manage those, the vendor, the EHR, how you want to scale, while maintaining reliability and honoring the patient experience? How do you sort of synthesize and prioritize through that whole, maze of data and feedback and agendas? Like, how does your team do it?
Yeah, I would say first and foremost, experience. The nice thing about MGB's home hospital program is we have a lot of history, and so we have learned a lot through trial by error, which I think is realistically the way that we move ahead in all of this. Is that it's new, so there's no way we have a blueprint of what the right approach is or what's going to be the most successful. And so we're kind of living it and writing it as we go. And so I think that's the exciting part of it. There's obviously risk involved, and I can, from the provider standpoint, see where that risk feels a lot heavier, and often is, because we're caring for patients and want to provide the best care. And if we don't have certainty that the technology side or the industry side has the best interest of the patients and the providers at heart, there really is no path forward. And so having that openness to that conversation, all being at the table together, like I said, with our vendors, it's always a back and forth conversation. It's not like we deploy and then we're done. We're constantly doing new improvements, new releases, new updates, and we're in constant conversation in weekly, bi-weekly meetings with our vendors to be able to provide live feedback, get their feedback, and know what their capabilities are, know where they're advancing in their technology. Does it align with what we're looking for? And then building a roadmap together to be able to collaborate as we move forward. Because again, with historically technology, business, and like healthcare oftentimes have been very siloed. And so products are being created based on problems that people think are problems, but haven't really investigated further, or they're retrofitted. They build a solution and they try to find a problem. And that's where you get a lot of wasted dollars, wasted time. And I think that right now it's really just from the get-go, having everybody at the table who is a stakeholder, understanding the difference in their motivations and in their bottom lines, and then moving from there and recognizing you're not always going to align, and where you need to make some compromise, you make the compromise that is appropriate. And that's a big part of how we decide as a healthcare provider who we engage as vendors, because we really need to vet to say, like, A, does this fit our workflows? B, is their culture, in their work culture, align with ours? And C, like, do we see a future roadmap based on kind of their prior engagements or prior solutions or whatnot? Do we see a continued relationship forward? And can we fulfill a lot of our goals in our future with the support of their solutions? And so I think that those are all things that need to be strongly weighed and considered when looking at what vendor relationships are ones that are worth pursuing. And so we do look at a lot of that because there's so many devices, there's so many solutions, there's so many software solutions. So we really have to think through, like, what makes one more favorable, or I guess you could say aligned is a better word, than another. It's not that the product necessarily is better or what they're offering is better. It's just that it aligns better with where we are now.
I think that's some incredible sort of wisdom that you just shared with, possible health system buyers of this kind of a product. I think, it sounds like it has very little to do with what the sort of latest, sexy wearable might be, and much more to do with the culture around collaboration and communication and advancing that shared vision together. How would you sort of assess your program in the broader, scheme of national health systems that are exploring hospital at home capabilities? Like, it sounds like you guys have are sort of on the forefront of it. You've maybe scaled more than most. You have deep integrations in the broader organization, including the business side. All these things I can imagine other health systems maybe struggling with a little bit.
Seeing that journey has been really informative, and it also puts us in a place where we have a lot of insights and learnings to share, because why should another program that's just starting have to struggle through the same many years of challenge and mistakes that we've already made and can share with them? So I think that's a big movement in terms of home hospital as a whole, is that there are more programs now. There are more people having these experiences that can share these experiences, more people innovating in the space and having creative solutions or engagements that we can learn from. And so that is kind of what I have found to be such a blessing, is that even though we have the years of experience we have, now that we have so many other brains to tap into that are in this space, we can grow and improve even faster than we otherwise could have. And we're also accumulating a lot of data, and being the program that we are. I mean, I believe we're the biggest program currently in the United States. And if not the biggest, we are one of the biggest. And, I can say for our metrics for last month, like our average daily census is about 40 and our capacity is 50. And in August, we are going from 50 to 70 patients capacity. And then we're also expanding in the mid-month to 72 towns around the greater Boston area from 66. And so we're constantly growing. We screen almost, I think last month we screened almost 10,000 patients, to see who is a good candidate for a hospital. And our last completed month in June, we admitted like 236 patients. And so it's really great now that we have all this data that we're collecting. We can actually do a lot of iterative work and reflect on how are we doing? And then really doing root cause analysis and looking into how can we find other creative solutions to address some of these challenges that we may be seeing evident in a lot of the data that we have in our sort of analytics. So again, we didn't have the volume to do this prior, and obviously the technological capability to do this prior. And so this is all internal, but imagine take that and take it across all programs. Like there's a lot of data out there, and there's a lot to say like around safety and around what is what technologies people are using, and learning from solutions people are building within their EMRs to support their hospital at home program. And then not just health providers in terms of like hospitals that have homegrown programs, but you have other industry players that are kind of have a plug and play model of home hospital and are bringing their product and also can contribute a lot of knowledge. So it's just very exciting, I think, for me as a leader in the home hospital space to be able to know that there's so many things that other people are doing well that we don't have to trial by error for. We can learn from them. And there are a lot of great groups across the nation that are focused in hospital at home and allow us to come together and, define best practices and to discuss what we've learned. And so I think that's very exciting and something that wasn't possible when we didn't have that many programs to share knowledge with. And I imagine it will only continue to grow.
Since you are at that scale, I'm curious about the demographics. Who are the sort of primary recipients of this program? And how do you think about growing it? Is it growing within that demographic, or is it looking at other sort of target audiences or patient populations?
Yeah. Well, I would say the good news is that when we've looked at our demographics, we match pretty well to what's the traditional inpatient model. I will say there's some I wouldn't say discrimination per se, but inherent exclusions that we have to put into place in order to have a successful home hospital admission that will select out for patients who are homeless, patients who have substance abuse, not so much by race, but if you talk about sort of the hidden factors of socioeconomic status, therefore maybe predicting likelihood of having home supports or being homeless or having substance abuse problems could be part of that mix. But in large, just across like race, ethnicity, female, male, and then also age, I would say we definitely, it's pretty comparable to the inpatient, but I think for age-wise, we definitely have more geriatric population, which is, I think really great because it supports the sort of aging in place movement that's been going on for like a decade now, really trying to figure out how do we support our elderly in their dignity and autonomy, which in big part is allowed by being in the home and supported by the loved ones that they do have in the home. And I think this was actually funny enough a blessing during the pandemic when we had really limited visiting hours and visitors were only allowed like one person at a time. And you have people who are living in a home full of loved ones and supports that now, if they're in home hospital during the pandemic, have the ability to be supported by their loved ones. And I think that makes the transition from hospital back to their home situation after discharge a lot smoother because they are already in the home. So we have been able to figure out how do we leverage their home supports and and even their home environment, their home setup, the bathroom is here, their room is here. Like, can we get them some medical devices to help them or, durable medical equipment to be able to make their life easier? And we can see that and we live it with them. And that is so unique to just being in the home. And so I think it really favors and supports the geriatric population. And I think in large, the geriatric population tends to be the type of people who get admitted to the hospital. So again, I don't think we're in any unbalanced way selecting more for them, but I do think we support them in ways that are really unique and really, really valuable. And then, of course, we have our young folks who are super independent and don't really need to be in the hospital if they're getting IV antibiotics once a day and don't need anything else really and are super independent. And I think they benefit hugely from the program too. So I think, to circle back to sort of the split, I think we want to be equitable to sort of what the inpatient setting is as much as we can be. And then from there, whatever we can support. So we are going to look at homeless hospital at home. We are going to look at rehab at home. We are these are all things I can see in the future, if not already in motion, to provide for more people and to even take away some of those inherent barriers that we currently have. So I think that that's a lot of the work that we're going to do is build new clinical pathways and build new pathways that support certain social environments or social histories. And then, I think a lot of the patient identification work that we're doing now can be even further sophisticated to be able to triage patients based on, varying factors that allow them to be a good candidate or a less good candidate for our program.
Thank you, Dr. Yang, so much. If anybody wants to find you online, how can they reach out to you?
Yeah, the easiest way to find me and reach out to me would definitely be through LinkedIn. Feel free anytime to connect. And if you have ideas or questions, thinking about your own home hospital program, trying to build up your home hospital program, would love to hear and learn from your process. So definitely do not hesitate to reach out. I'm Caroline Yang, MD on LinkedIn, and definitely reach out and look forward to hearing from some of you.
Thanks so much for joining us. You can also connect with us on LinkedIn, YouTube, or on our website at productandhealthtech.com. If you have ideas or suggestions on what you'd like to hear in a future episode, or if you'd like to be a guest, please just shoot us an email at info@productandhealthtech.com.